Thank you, Lauren, for starting the recording. I will present because we have just a couple of slides to guide our conversation. Plus, I always like sharing new things with you so you can see what's going on. Here we go, January 18th. Time's flying by. We've had a group that has a very busy professional schedule, and yet people have really done amazing things to be here. So very appreciative of all that people are doing, and we understand there'll be times when you just can't make it happen. And then our medical group goals, and the group has been absolutely wonderful in ensuring that everything we're doing is in alignment to the intention for the group, and everything that has been offered thus far has been appreciated, respected, and utilized. So we'll talk about that in just a minute. And of course, a reminder that in Oregon, everything we do is driven by our values, what we believe to be important in providing the highest quality educational experience. And then as we moved through the pandemic, we've used those values plus a little bit of something else to help guide our decision, like the ability to be very flexible, prioritizing health and safety. You can see that all on the screen. And then finally, why are we here? Our purpose as a group. And that really is to provide an opportunity for all the participants to share their professional suggestions and on how the Oregon School District can best get kids back into school safely and keep them in school safely. Now, the key question for tonight is right here. And this is where I'm going to pass it over to Drew Howick for just a moment.
Great. Thanks, Leslie. Good evening, everyone. Yeah, so I want to take you back to a discussion we had on December 7th when we asked some pretty broad questions about things that the district ought to be paying attention to as they phase in. And many of you identified the discussion question that we're going to get to tonight. I went back to the notes and looked at some of those themes. They were around school community engagement, so motivating our students and their families to practice safe protocols, educating the community. How do we do this so that our kids are in school and learning about together, and community knowledge, understanding the role the community plays in managing the pandemic. So that will be our discussion tonight. And this is the framing question that we will use tonight. We're going to have the discussion in a full group, given that we have just one question and the value that learning from each other collectively gives us an opportunity to do that. So Leslie will give you an update on what's happened since our last meeting, how some of the suggestions you have provided have been utilized, and then we'll frame up this question and give everybody a chance to share their thoughts on how we might be able to do this. So thank you. Back to you, Leslie.
All right. So we'll just go over a few things. This is our agenda for tonight. First, we will talk about, remind everyone what we did on January 4th, share updates, review our working agreements, and then launch into the large group discussion on that key question. And then move our conclusion. We'll talk a little bit about masks and input people have on that. And then we'll talk about our next meeting. So what was our meeting like on the 4th of January? Well, we had small group discussions. We had 3 small groups, and there were recommendations for what we need to consider as we phase in more students to in-person learning. Those recommendations came from our mental health experts on the committee, and our Oregon School District mental health experts were also there in order to hear it and to take in the advice that was given. And multiple themes emerged, and they've been very helpful in how we've moved forward, and I'll talk about that in just a moment. And then we also talked a little bit about athletics and whether or not we should continue or we should consider competing outside of the county. So that's what we discussed, and here are some of the next steps. So the Oregon School District mental health professionals that were at the meeting, and there were several, they went back to the larger 27-person department and discussed the recommendations and how they fit into their plans, how they could be additions or enhancements to their plans. So all of that information was transferred to the people who are boots on the ground in the district and are really doing the work related to supporting students and staff and their mental health. Because if you remember, one of the really key considerations to come out of the group was you need to consider staff mental health in all of this too. And then we shared that particular piece with our principals to make sure, I mean, we've been talking about that from the very beginning, but to make sure that that was at the forefront of our planning. And one of the things that our staff members tell us very frequently, because we ask them often, what do you need? And what they need is time. They need us to find ways to give them more time, because I think this is the third time thus far since the pandemic started that we've asked them to completely overhaul how they're teaching. So you can imagine just how much that is to ask of people, and what they need to do it well is time. And that is what they would tell us is most beneficial for mental health, is the ability to feel like they have the time to do what they need to do. And then after our discussion on the 4th, you may know the board held a special meeting on the 5th. And that's when they took the information from public health, from the medical advisory board, from input we were getting from other participants and other districts, try to make a decision on whether or not we hold athletic competitions outside of the county. And when balancing all those factors in together, I would say that the mental health benefit to students and being able to actually play is something that really won out. People wanted to be able to do that for our kids because they knew how important it was to them. So our sports have been competing, and with really, really rigorous protocols related to what they do prior to practice. They have to fill out a form by 9 a.m. every morning, indicating symptoms, and then anyone who indicates even one symptom receives a call from the athletic department or the nurse, and they work through whether or not the student stays home from practice. So, and then there's rigorous protocols for the games, and it's limits to how many people can be there. And so a lot is being done to try to make this the safest possible outlet for our students, because we know that some of the things that were already happening, they weren't having the same high levels of safety standards in the things that they were already participating in. And then the board is going to review that decision on January 25th, so a week from tonight. A couple of other things I wanted to make sure you were aware of, because you were really instrumental in making sure we paid extra attention to it, and that is the transition plans. So every teacher who's getting a new student, because there was a little bit of moving around as people moved from phased restart to Oregon Online and the other way, teachers are doing meet and greets with students and families for every new student who's in their class. Social emotional learning activities have already begun, because we know that orienting our students to a new environment, whether new means in person or it means a new teacher, all of those things take a lead up, and it's something that you do for a long period of time prior to it happening. So we're having lots of discussions about what in-person will be like. Our freshmen are getting some orientation tours on February 3rd, where teachers are helping students better understand their schedules and how it works. And then PBIS lessons at every level to prepare our students for protocols. So we're working hard on the transition piece, because being 12 years old and starting a brand new building, I'm thinking of 7th grade right now, without any idea what it looks like in the building, and you're supposed to go there and follow all these safety rules, kids are going to need some support. I also thought it would be really interesting for the group to see the semester 2 selections by demographic. So we broke down phased restart and Oregon Online by demographic, and you can see overall About 74% of our students, our families, selected phased restart, and about 26% of our families selected Oregon Online. But you see that when you break it out, you see something very different. And you see how there may be lots of different ideas about what's the best thing for families. And I think one of the things that it really highlighted to us, and we already knew it, but it really put it under the highlighting there, is how important it is to ask people and not make assumptions. Because there are a lot of people who say things such as schools need to reopen more quickly due to equity concerns. And perhaps, but I think there are a lot of families that aren't quite ready yet. And when we have done some phone calls to try to better understand, and we have a lot of work to do to really get a good handle on why people chose what they chose. But some of our anecdotal evidence is there's a lot of families who don't want to come back in until the vaccine's ready. You know, there's lots of different reasons for that. And then you can also see there's quite a difference in our special education population of students, our students who are eligible for free or reduced lunch, and our students who are in the English Learner program. It's the first one where the majority of students are actually selecting Oregon Online. I just thought you would find that interesting because we do bring up equity-related concerns in this group quite a bit, so I wanted to show that to you. And now we're getting back to our key question, and that's when I hand it back to Drew again.
Sure. Before we move on, I'll just invite, is there any questions you have of Leslie about the update and what's occurred in the last 2 weeks since we've been together?
Drew, it's Krista. I just wanted to point to the slide that Leslie just presented and just echo how very important that is, because a lot of times we make assumptions about phased restart or getting kids in school and maybe not pay as much attention to that we're also serving kids that are online and really looking at who those kids are and where they come from and what struggles they have. So I'm just going to draw extra special attention to this slide, and I really hope people digest it. Thank you.
Great. Thank you, Krista.
Yeah, Krista, thanks. This is Jelly. I just wanted to chime in there. I think we know that, especially in Wisconsin, the Latinx and Black communities are predominantly those who are essential workers and have been going into work. And we also know that they have had the worst outcomes from COVID. So this is no big surprise, and I'm grateful that we're offering choice, but also remembering that so many people don't have choices when they're being told to go back to work and facing a lot of tough decisions. So thanks for highlighting this. And I think as we continue to ask the questions about how do we support our entire community, it's these folks I'd like us to be centering on.
Thank you, Shelley. Okay. All right. Let's talk about our discussion question tonight. There have been, at least at 5:30 tonight, 6 people who were able to actually respond to this question online. And so we thought we would start with them. And if they would like to talk a little bit about their piece, we'll start with John, Tempty, Amy, Joanna, Becky, Even, and Bill, if those individuals are all with us tonight. And it's a chance for us to listen to their suggestions. And then we'll invite others to also comment. If a suggestion's already been made that's in line with what you were going to share, just mention that. But we want to make sure everyone gets a chance to get their voice out, and then we'll talk about them, discuss, ask questions, build off of other comments, as it says here, and so on. So what we're after here is what can be done in order to go back to that framing question.
You got it.
Yeah, there it is, to encourage our citizens. So we're less interested in the how it might actually occur, because the how is, there's a lot of different ways to go about doing these things. And Leslie will be working with her staff and other professionals that might be more expert and experienced in actually figuring out how to do these. So we'll try to keep our comments more about what can be done. And let's see where that conversation goes. Okay. So I'll just start with the list. John, if you're with us, I can't see all the folks who are with us right now. Maybe you could talk about your suggestion.
I actually did not see John on the list, and that may be why he shared something before the meeting.
Okay.
Well, I'd be happy to go over what John mentioned.
Yes, please.
John spoke about the Badger Pledge, and I'm going to copy it and put it in the chat so that if anybody wants to click on the link, they can take a look. But it was helping people in the Badger community have a better a reminder, basically, on what it. Gosh, I'm sorry, my finger keeps making this jump all over. Have an understanding of what it was they were agreeing to, what they were pledging to do as part of the community and keeping the community safe. Mm-hmm. So John made a suggestion that perhaps we consider something similar for the adults and children in the Oregon School District.
Okay. And once we hear from everybody, we'll make comments or talk about that and other suggestions that were made. So, Amy, you're here. You made a suggestion. Maybe you could tell us a little bit about your thoughts.
I just saw that she left the meeting, so I don't know if she's having technical difficulties, but her name just popped up as having left the meeting.
Oh, okay. Well,
I saw it too. Oh, there's Amy.
Now she's back. Amy, you're back. Great.
All
Tell us a little bit about your suggestion, Amy.
Yeah, sorry, I'm having a lot of internet issues out here tonight. So this might be more of the how. So I was just trying to think of ways our school district staff can partner with other community leaders and businesses to create, again, just some kind of informative videos to continue to kind of share that message of mask wearing and staying that 6 feet apart to keep everyone safe. And then my second, more of a comment or idea to also include other groups that are continuing to meet, like those youth sports that might be meeting, to make sure that they also, because those kids go home to families, and making sure that there's some kind of unified message, again, just to keep people safe and to create partnerships.
Mm-hmm. Okay, great. Thanks, Amy. Joanna, are you with us here? And if so, maybe
she is not here this evening, and neither is Dr. Hefner. So I think it's time to maybe just move to Becky.
Okay, great. Thank you.
Yeah, hi guys. So I just kind of had touched on the vaccine process and everything. I think that right now that's a kind of a hot topic in everybody's life as to, when they're going to get the vaccine. And I think that our community probably has a lot of questions, and mine was just kind of a suggestion on just kind of making this group or some sort of a campaign to kind of push the vaccine. I don't want to be a vaccine pusher, but it is something that I completely agree with. And being as someone who has actually had both doses, being able to let community members kind of know what to anticipate. I know a lot of people are scared to get something so new, but just kind of being available for like a Q&A. I think knowing that your second vaccine is kind of takes you out for a day. I think it's important for people to know that. It took me out. It's taken a lot of my coworkers out. But I think just kind of getting the word about what to expect when getting the vaccine, just to try and get as many people as we can to get it, and as quickly as we can.
Okay, great. Okay, thank you for that. Evan, you shared some information as well.
Yeah, so really just two ideas, kind of at a high level. I think, and I mentioned not to like rain on the parade of the idea of, very excited to be going back. I know my 8th grader is extremely excited. But I think when we look at one of the key things is like, okay, well, making sure that it's not viewed as like, oh, we got to the end here, because there are still a lot of big things out there. So I think it's important to make sure people understand where the school district might be on some of those bigger issues and how they might actually still happen this school year, if that's a possibility. And then I just said it on a practical, like on a very day-to-day level, I think the key is making sure that all the systems in place are accommodating so kids aren't ever feeling that they need to show up to school. So, if they've been exposed, if somebody in their family isn't feeling well, that those are very easy things for people to just say, I'm not coming today. So that's it.
Okay, great. Thank you, Evan. All right. Leslie, are you in a position where you could share or paraphrase what Joanna and Bill shared with us as well?
I can. So Dr. Risgrove mentioned, she called it Adopt a Grade, and I'll just read what she wrote in here for us. And she said local businesses could partner up with a particular grade of students and come up with motivating messages on wearing masks, social distancing, washing hands. Employees at businesses could also be email or Zoom pals with students who are more socially isolated and need support. So I think she's thinking of something like a mentoring program. And that she's thinking of rewards, silly prizes for kids with creative masks, so kids who keep their masks on or consistently follow protocol, that sort of thing. So I think the overall focus would be trying to connect community with students and encouraging good choices back and forth.
Mm-hmm.
And then Dr. Hefner gave us an article on masks that I plan to put in our resource document. And in addition, he talked about how important it was to survey parents after every 2 to 4 weeks, parents and students, regarding their experience of in-person learning versus virtual. And then he's saying he hopes that the positive response will come, that there's more engagement and more successful learning with more in-person learning, more parental satisfaction as kids are back in the classroom. And we should share these results widely to the community, particularly the parents, to support in-person learning and garner continued community and parental support in keeping the kids in school. Mm-hmm. And he also says that he believes we'll be able to show that transmission is not happening and that will continue to bring support for keeping kids in once we get them there.
Right. Okay, good. Thank you. All right. So you've heard 6 individuals who posted before, but we want to make sure we hear from each of you on this question as well. And again, the framing question is the efforts that we might take to encourage our citizens to work together to keep our students in school. So please share your thoughts. Anybody can begin.
Drew, can we maybe or Leslie, can you stop presenting so we can see everyone? That would be really nice, I think.
Absolutely.
Great. Good
Thanks.
deal, Krista. Thank you.
This is Matt. I can start.
Okay.
I think something that Orchards does already has been really helpful for the flu and cold. They send out those little fridge magnets that tell you how to cover your cough and wash your hands. I think getting some information out to the families along the lines of, here's what we're asking your kids to do. If you want your kids to stay in school, your family should also follow these simple basic hygiene stuff that everybody should know now, but I'm guessing some people don't. Just encouraging mask wearing, encouraging hand washing, all that stuff.
Mm-hmm.
The take a village approach is an easy way to frame this from a sales perspective. I think that's what we're talking about here.
Yeah.
Come
So
together as a village.
Yeah, so it's using another medium and magnets as an example to reinforce the message.
Get that hygiene stuff out there and make
Mhm.
sure people know you have to be a participant in what we're doing here if we want to make this successful.
Right. Okay. Thank you, Matt. Other suggestions?
This is Tim. I think consistency in lots of different mediums is very important. Those trinkets, those refrigerator magnets, I'm sure somebody out there has the little, Live Strong armbands that can be used to remind kids on a regular basis how important, one specific thing is, or two specific things: wearing masks, social distancing, for instance, covering your cough, etc. I think having little contests, come to school with, and I think we need to be careful as well, come to school with a mask that shows your personality, kind of thing. A drawing contest for masks, whatever the case. I just think making it fun and making it interactive, I think, could be very engaging, especially for the younger kids.
Mm-hmm. And that last point of yours, Tim, builds off of Joanna's idea about a mask contest or
Yes,
some
exactly.
creativity there. Okay.
Mhm. You bet.
Yeah, great point. Shelley, it looked like you were ready to jump in on this here.
Yeah, I was just going to comment. So I'm in public health, and we're, as you can tell, notoriously bad at communicating on these things, right? So I would really kind of defer to others in this space. Like, I think, Krista, you're a marketing, that's your job, right? And I think this is a space where we should really be leaning on the talents of others. I mean, I think we need to break this down for people and create small wins. And there's a lot of things we can be doing and really reinforce that whole notion of we're all in it together. But man, public health has fallen flat on this. And so I would love to see, Oregon School District create some examples of how we could really communicate to folks on these really difficult things. But I can't say that I think we know all the what, right? We know all of those things.
Got it.
Yeah, I'll just jump in on Shelley. Really good marketing is emotional and intellectual. And so I really like the concept of Evan's idea where you're emotional with people about things that are important to them. If it's graduation, if it's prom, if it's an end of year activity, what are the things for our students and families? It could be going to school, but there are other things associated with our school district that really people are passionate about. And so then you get them in the passion, and then you talk with them about, now here's how you do it to get there. And that's the health and safety measures, right? And then I think the other piece that's, potentially this group could talk about is who are the influencers in our community that either have a way to communicate or people listen to. And Amy talked about that with youth sports organizations, or as the Boy Scouts and Girl Scouts. So, what are those groups that really have influence or ways to communicate effectively and repeatedly with members of our school district community?
Yep. Great. Thank you. Alice, let me just turn to you. What thoughts do you have on efforts that we might use to encourage the citizens, the community, keep kids in school?
Thanks. Well, I'm pondering this, and I teach at the UW, so the Badger Pledge is interesting. I think what I keep getting stuck on is that we can sort of control what kids do in school, but the place that a lot of these kids will get COVID is from their families, or from the things that their families are doing, and that's a tougher thing to control, right? especially as a public school. I have friends in other parts of the country, or friends that go to private school where their schools have like pretty strict sort of family like if you travel, then this, if you travel, you can't come back to school for 2 weeks, or that type of thing. And I know that's harder in this, in our environment. But I think I liked what Matt said about, stuff for the family, stuff at home, and ways to influence, because if a kid wears a mask all day in school, which they will because they have to, but their parents don't wear a mask and have parties, and, it's going to be, or not. So I'm still pondering about messaging to parents and families.
Sure. Okay. Well, ponder away. We'll hear from everybody else, and then we'll have a discussion on different thoughts that have been advocated for. So, Raven, could I turn to you? What are your thoughts and suggestions for encouraging your citizens?
Yeah, I don't know that I have any new suggestions, but I did want to comment similar to what Alice had mentioned is our population. So I think our younger learners are more supervised and controlled, and our biggest population to aim this at is the parents, and then those high school students that are off on their own a lot, especially if they have a little bit more flexibility with their school schedule. We're seeing them hang out at like skate parks or outside of those athletics, or hanging out outside without masks on in groups. So I think targeting that population is going to be a big one, because that's where we're seeing more of the spread, not so much with these younger learners, but parents bringing it into the home, and then those high school students outside of those controlled activities.
Yeah. Great. Thank you. Jill, what are your thoughts on this?
I think in some ways I'm piggybacking a little bit on Evan and Krista. So Krista talked about kind of the passion and the emotion part of it. And I think about then how can we tie that to behavior, right? Because that's what we want. And so I'm thinking about this like in terms of when I did psych evals forever, and for the juvenile justice department or social services, and people want to know, well, why do people make these, judges and social workers, probation officers? Why did this kid make this choice? Why did this parent do this? And then most importantly, are they going to do it again? That's the $1 million question, right? That everyone wants us to predict. And we know that human behavior is so hard to predict. One mantra you might hear around that is past behavior is the best predictor of future behavior, right? So the good news is those folks that are wearing masks and washing their hands and keeping social distance, they're probably going to keep doing it. And they're not going to need a whole lot more to stay on that. We don't have to probably worry about them very much. All these ideas, these friendly reminders, I think are great. There's some really creative, good stuff here. But what about those people who haven't been engaging in those behaviors? How are we going to get them to change their behaviors? That's kind of what we're asking here. How can we get more buy-in? And humans generally need some kind of incentive in order to do that. And I don't know if, what we have right now is enough. So like what Evan was alluding to and what Krista was saying, is there a way that we can give them some specifics? Like, here are the next steps. If we do well for this many weeks, this is what we're going to move to next. Or, if we do X, Y, and Z, can we have prom? Can we have every other day a full day of school? Something more specific. That's the other thing. It has to be specific in order to get behavior to change. And I think if we can lay out some next steps, we might get people to buy in more, those people that need more of that incentive to really change their behavior.
Mm-hmm.
I really like the incentive idea too. I think the other thing I just want to throw into the conversation is, as we do this, kind of the caution, how do we not create blame, right? So, back to our table of our marginalized populations, we know, right, that those folks are going to work in tough situations and not getting PPE and all of that kind of stuff, and so are more likely to get COVID, and therefore their kids are more likely to get COVID, and so on. So it's like, I just want to make sure that we're also not setting people up to be blamed, I guess,
Mm-hmm.
magically.
Oh, great point, Shelley. Thank you. Good. All right. Who haven't we heard from? Erin, what are your thoughts on how we can get the citizens and the community to work together?
Yeah, so I have a couple of thoughts anyway. I think if I work off the mantra of knowledge is power, right, and we get more information out there to folks, the more likely they're going to be making the good choices, or the choices that we want them to be making. I think the district is doing a really, really good job with transparency and kind of presenting the numbers to kind of know where everything is. Unfortunately, I have to go seek that out in order to kind of see those numbers. So perhaps another medium to kind of to have everything kind of that transparency more out there, right? It is easy. It is easy enough to go to the website, but I'll be honest, I don't go to it all the time. I go to it prior to our meetings here, and that's because I'm involved in this. So I know we're not talking about hows, but my idea would be maybe we have like a conference call where parents can be involved and engaged and kind of feel like they can have their voices heard a little bit, or they can kind of just sit back and listen to what has been going on, what's went well for us, kind of a brief kind of SWOT analysis, right? What has gone well this week? What do we need to work on? And kind of bring them into all of the things that the school district is thinking about as they move forward with these plans. The other thing, the other perspective that I also take with the mask wearing. So I talk with my clients for the past 2 weeks. Everybody comes in. We're all excited about going back to school, but what do we have to do in order to stay in school? None of them want to be wearing their mask. So we do a cognitive shift, like what's so wrong with wearing the mask, right? And we kind of go through what they don't like about it. And we talk about it's not so bad, right? If I wear the mask, I get to do X, Y, and Z. And that is much better than not wearing the mask and not getting to be able to do X, Y, and Z, right? So then I also look at that from how we do a lot of the bully prevention programs has to do with peers standing up for one another, right? If a child is getting bullied, the best way to kind of bring that down is to have a peer stand up. So being able to kind of empower students to like tap another student on the shoulder and say, hey, not necessarily tapping, right? Because we're social distancing, but to be empowered to say, you know, you got to put your mask up. And so that it's not only leadership and teachers and other community members, but it's also the peers that are saying, hey, this is what the norm is, and this is what we're doing because we all want to be here.
Mm-hmm. Yeah. Great points, Erin. Thank you. All right. We have at least one person on the phone, so I don't know who that is. Maybe they could weigh in and or not. Anybody else here that I'm not seeing on our visuals that we haven't heard from yet?
I come running through, and I don't think so.
Okay.
I think we've heard from the members who are present right now.
Okay, great. So let's open it up for a discussion. There's a lot of different ideas. Again, we want to focus on what can be done more so than the hows, the specifics. So some of those specifics, as Erin just mentioned, are very, intriguing, the different ways of doing that. Thoughts on what have you heard, suggestions from other folks, even if they weren't here, that you, how you responded to those ideas, or things you like about it, you find intriguing, maybe questions that you have of someone's suggestion, or maybe even a build off of what you've heard. Please weigh in.
I thought Erin's comment was interesting, and something we should think about is like, what do we know? And maybe this is back to a Krista question, but what do we know about the people who are maybe, we've got the people who are all bought in, and we probably have the people who are never going to be bought in, but how do we move the people in the middle, or kind of continue to reinforce those folks? Or what do we do to, I think you said a cognitive shift. I'd be curious about how you do that, and what do you do to kind of build that up, I guess.
Yeah. Want to speak to our cognitive shifting experiences with that?
I mean, I tend to listen to the two mental health professionals that have chatted about human behavior. They know it best. And so is what is the motivating factor for people, right? You can change behavior if people are motivated themselves to do something that accomplishes something that they want to change or want to do or want to be. And so I think we have a focus group with our athletics right now, and we can talk to some of those kids that are now participating in athletics. And we've heard it through emails we've gotten from the board to the board about how motivating that was, and see if that's working. If that was something that was very motivating to them and has impacted their behaviors outside of that activity, more or less than what they did before. That would be interesting to know. Have you done more behaviors more in line with what you need to do to continue to play athletics, or has it not changed your behavior, or you've always done that behavior? That would be a pretty interesting little focus group that we've got over the last 2 weeks.
Mm-hmm.
I wanted to comment a little bit about Shelley's last comment to kind of build on that, but I also wanted just to make a note. Like, I really liked what Evan had to say, as well as you, Krista, and kind of similar to you, Shelley. I do feel like we have a spectrum of families with different kind of views on kind of where we're at. And I think, like with John's idea of that Badger Pledge, we will have some students and families that will be the nudge they need, and that's it. And then you might have families as you move kind of down the spectrum that are going to need more that intrinsic or extrinsic motivator kind of nuggets of incentives along the way. So I guess that's what I kind of think about as I heard some of Evan's conversations. Just like, yeah, we're gonna have families across that spectrum. So how do we reach each of those in different ways? I think it's gonna be multiple forms of social media. And I also think it depends too on the grade level. I think someone made a comment about that, but like those grade or age appropriate incentives, what's an incentive for a senior is going to be different than our fifth grader or our middle schooler. So to somehow weave those in to communication or weave those into surveys or things like that. And there is, this is more for like students and behavior, but there is a screener of sorts, like a questionnaire that helps get to intrinsic and like what you, if you're an intrinsic motivator or an extrinsic motivator, kind of that thought process too. So those are some of the things that kind of are swirling in my mind as I am hearing everyone's input.
Great. Thank you, Emmy. What are some other swirlings?
I do think I agree that this is really age group specific, and kind of this echoes a little bit, I guess, what Erin was saying earlier about kids kind of helping out with managing other kids. And I've seen that happen in our neighborhood. We let the kids play outside if they have masks on. And if a kid forgets a mask, it's always another kid that'll say, like, go get your mask. You forgot your mask. We're not going to be able to play outside if you don't wear a mask. So there's that. The other thing, depending on the age, is I didn't mean to downplay before when I said like kids are going to wear masks. Good education in school about the importance of these safety things. Kids will come home and talk to, I don't know if you all have experienced this, but like when my second grader, I think in first grade, learned what alcohol was and then was policing my wine consumption, like when kids take that information home, and so reinforcing in school some of it will trickle home depending on the age group.
Mm-hmm. Mm-hmm. No?
I just have a question or a thought, I guess, so we're talking about behavior and behavior change, right? And so, but we really haven't, and we're talking about how are we going to get people to comply, but what happens to the folks that aren't complying? What are the consequences for that?
Mm-hmm. Well, considering, we're an education institution, our first step is always education. Why is it important that you are following the safety procedures and protocols that we've put out? So that would probably be our first, second, and third choice. Unless, of course, the person's noncompliance is related to their disability. And then there's a whole other path to take. But if after education attempts and calls home, et cetera, then it becomes an issue of disciplinary consequence. And from what we've heard from schools that have had in-person instruction in the upper grades is that students are very compliant with their mask wearing in school. So we are not very concerned about that at all. You know, we're really more, it'd be great if we could find ways to help them remember to wear the masks when they're not at school. That would be helpful.
Right. So, Tim and Krista, as board members, you're listening to this. Leslie, John, Michael, Jim, as you're listening as staff, what questions might you have of the professionals here? And any of the suggestions that were mentioned, or any what ifs and how abouts and so on that might be helpful to you?
I think one thing that would be helpful for me to understand is whose voice is most powerful. I continue to look at it from a parent's perspective, and I find that the younger the kids, the more important a parent's voice and perspective is. And as they grow through middle school and into high school, the more important, again, from a parent's perspective, the more important their peers become. And so, and the louder those voices become. And so I think finding a way to, am I missing something there? Is it that simple? And hearing from some of the educators who are in the elementary schools or the middle schools or the high school could really drive that home. They know from their own personal experience what motivates the kids in their class. And I think reaching out to the educators in those areas would seem to be an important step as we begin to communicate in a consistent manner the importance of, wearing your mask, washing your hands, social distancing, et cetera, especially as we get back to school.
Is there any way that we could do any kind of survey? I'm thinking about what Krista was saying about the sports activities. The thing that is helpful about that, I think, is that we have both kids and parents who are really invested in that. And so then you have kind of a double win. You're going to get more likely for people to change their behaviors if they needed to move in one direction or another. Is there a way in which we could find out what are other things that are important that would help you be motivated to, take more precautions or follow all the public health recommendations? And then, going back to what we were saying before, like in terms of the incentivizing, then what is it that people most want? And then can we give them that, if you do this, then you can have that, kind of that. But if we don't know what is most important to people besides sports, then how can we be most effective? So I'm wondering if there's a way in which, I don't know what that would look like, but if there's a way in which we can kind of gather some of that information.
There's always a way to survey. There's lots of ways we can do that. I'm just trying to think about what exactly would we be trying to incentivize, because one of the things that we really want to make sure our kids do is we want them to report symptoms. We don't want them to not report. So what would we be trying to incentivize? Would it be how often you wear your mask outside of school? I mean, and that would be pretty hard for us to really know whether they're doing what they're saying they're doing or not. And we can't really tie it to the number of reported cases because we want people to report their cases, right? We don't want to do anything that would make someone think, oh, I don't want to be the one who reports and then we don't make such and such goal. So I'm just trying to think it through. We can survey. I just need, I guess, a little more help from the group as to what type of questions would be helpful and wouldn't disincentivize actually reporting the things that are important to report.
You know, and I think that's a really interesting point because you think about, you know, we've been in this pandemic for a year almost. And are we really going to be able to change people's behavior in a significant way? I think people have made their choices to this point. Are you going to wear a mask? Are you going to social distance? And how much are we going to actually be able to move the needle on that? And isn't the most important thing as we continue to educate that? But it's to your point, Leslie, of we want a safe environment. So it's kind of this be one of the team, and how you can continue to do that is you need to report daily how you're feeling, right? I mean, isn't that the critical piece more so than are we really going to, you know, we can still educate people and say, hey, we want you to, you know, these behaviors contribute to our safe school environment, but are we really going to be able to change people's behavior in a significant way? Or is it saying, we want you to be, we want you to follow the protocol of reporting every day? And that's really, I think, what we can do as a focus group with sports, because athletes have had to report by 9 a.m. every day how they're feeling. And if they don't do that, they're met at the door at practice, or they're met at the bus to get on for a game, and they're told, sorry, you can't go. And so, you know, that's a pretty big negative consequence. And so even if people are not following the behaviors that lead to good results, we still want them to care enough about their community to say, I'm not feeling good today. I'm not coming to school.
And that really builds on, oh, I'm sorry. I'm just saying that builds on what Evan said.
Yeah.
About, you know, making sure kids know to stay home when they're not feeling well.
And maybe that's just us getting pretty clear on what it means to be a member of the team, right? We expect that people are going to get sick, actually, right? And so reporting, staying home when you're sick, that is being a good member of the team, right?
Yeah, that's the Panther Pledge, right? The Panther Pledge is you don't come to school if you're not feeling good.
And then we better make it really easy to access instruction if they stay home.
And not to say you don't have the messages about what helps you stay feeling good. If you do these behaviors, you're probably not going to get sick, but it's really about keeping our community safe and healthy. Because some people don't believe in 6 feet of social distancing, and some people don't believe in masking. But
I do wonder, though, what, if any, impact it would make to tell more stories about people who have been affected by COVID. I think people have been drawn towards the numbers, but I don't think they digest the numbers as they digest stories, right? And so you see that back to our, you know, our table of different demographics and stuff. The folks who are choosing to stay home are also folks who are probably more likely to have seen bad outcomes from COVID. And so I think, I don't know that, I'm not suggesting like a scare campaign or anything, but just more awareness of what's going on a human level rather than a numbers level.
I can kind of speak to the scare tactic in that it just doesn't work. Unfortunately, like I've obviously seen lots and lots of death from COVID, and I've talked to lots and lots of people about what I've seen, and people have their minds made up. And until it affects you personally, you're gonna think how you think. It's like addiction, you know. Addiction is horrible as everybody else's problem until it affects you or your family personally. So we can try as much as we can, and I can tell stories till I'm blue in the face, and people just, until it legitimately affects you personally, people aren't going to change how they feel, unfortunately.
I think one other thing. Oh, go ahead, Jill.
I think kind of an interesting thing about that is to think about what if we also had the framework. I certainly want our kids to stay in school, and I don't want people to get sick. So I hope that is clear. But if we have to shut down for a brief period of time because there's been an outbreak or whatever, I think we can use that to our advantage of not use that to our advantage. That's totally the wrong words. I think what I'm trying to say is that doesn't necessarily mean that that's going to be all negative outcome from that, for the very reasons that Becky's talking about. Because then some of those families are going to be like, oh my gosh, now my kid can't go to school at all because of what happened. And they have to learn it themselves personally in order to really feel it. I've talked with people who have had that in their districts, and then after that brief turnout, people are more invested and they come back and they're more doing what they're supposed to be doing all along, because that group needed to learn it firsthand, which is sad and unfortunate, but it's true.
And to speak to that too, that we are seeing like fatigue, like it has been almost a whole year. So even those people who were wearing the mask and staying social distancing, we're starting to see some of those people like, well, it's been a full year. And so I think those constant reminders are super important, even with those people who have been doing it. They're having some almost burnout at this point. So.
I just want to kind of make a comment that, no matter kind of what venue we are talking about, getting information out, I just want to just reiterate that, that it's non-judgmental, not shaming, culturally responsive, and that we really look at representing everyone. I mean, our group is pretty homogeneous, and I just want to make sure that we are all inclusive in the message that we do send, to continue to build upon like our district's values and our mission along the way.
Mm-hmm. Yeah, that's a great.
Building on that, and this might be a Amy or a Raven question or comment, but just thinking about the kids who don't have a parent at home in the morning, perhaps, or that life is so chaotic at home that there's not somebody to check in with them about their health in the morning. Will there be sort of supports for those kids so that they kind of don't get missed and, come to school with illness or something? I'm talking about unfortunate, staff school supports, because I know that there are families that are just in such a difficult situation that that's not going to be on the list in the morning, or that there is a parent in the morning, and just something for, I guess, nurses and social workers in the schools to be thinking about.
Mm-hmm.
Yeah, that's a really good point, Alice.
Well, and potentially, Amy, in terms of you all will likely know who those students are, and is there a way in which they can do that, via a Google Sheet or Google Form or something that they've become accustomed to doing with classwork online? That's something similar, like we do for athletics now, or if we potentially get an app or something like that, students are able to do for themselves that empowers them. Like you said, if there's not a parent present in the morning, that would be great.
A side note, but even at the high school and our student services, we're trying to, in the process of developing like a QR code for students to set up appointments. So I don't know if that would play into this at all, but.
I have a practical question, and I feel like I should know the answer, and maybe it's bad I don't, but if some kid just wakes up, I've got an 8th grader. Some days she wakes up and doesn't feel great. And the reason I'm asking is this gets to the issue of like, how penal is it to say you don't feel well? So we don't send her to school. By the middle of the afternoon, she feels fine. What is the expectation for, like, what are we asking people to do?
Yeah, so any symptom that's called in, an absent that's called in due to illness, is reported to a spreadsheet, and then one of the nurses follow up. So our symptoms checklist kind of lays it out. So if there's one, like if your child would wake up with a headache and it's just one symptom, we're still following up. We're seeing how they're feeling. We ask the parent to continue to monitor that student symptom, and then we go through the list of symptoms of illness. If a second symptom would arise, then we're staying home for 10 days, negative COVID test, or physician's note with an alternate diagnosis.
Okay.
Yep. And everything, if like a student is having one illness, it's an exemption. So it's not penalized. It's not an unexcused absence. It's an excused absence.
Yeah, obviously there's some people that if they're like, well, geez, I'm going to have to stay home for 10 days now, becomes the big issue. So, okay. So it's just nurse directed follow through.
Yep. And we are fortunate too that we have Orchards, right? That is a resource that can come straight to the home and test. And we're having pretty quick turnaround with results for that.
Oh, really?
Mm-hmm.
That's cool.
Yeah.
And just to clarify, what are they testing for? Are they testing for the flu or are they testing for COVID?
Orchards can test for COVID as well as the flu.
And they do. All right. Thank you.
Okay.
You know, and that's a really cool point because a lot of people in our school district are familiar with orchards, you know, and so that's an amazing resource that can also be added to our communication that can help boost that.
Mm-hmm.
And as a parent, I just got a postcard with that exact information about orchards and how they test for both.
I'm sure I did too.
Ask your wife, Evan.
She'll be like, I can't believe you asked that.
I want to thank the nursing staff because not only are they following up with every family when a child's not there, but now they're also doing it with athletics. So many thanks to our nursing staff members.
Yep.
Really appreciate that.
Yeah, and to hear it so confidently and again in a very protocol-oriented manner, it gives me the confidence because we don't have kids in school. It gives me the confidence that we have, a very specific protocol that everybody is confident that that's how it works. And Raven, just the way you described it, just gave me so much confidence in knowing that, hey, if my kid wakes up with just a headache, we are pursuing that until there's nothing. And we have partners in our community, the Orchard Study, who help us do that. So just the way you described that, I think is very huge confidence booster for me.
Great. All right. I know Leslie wants to get some input from everyone on masks before we wrap up this session. So thank you for that. All these ideas are being recorded. That'll be transcribed, as always, fed back to you, etc. If after you look at that list or later tonight you go, oh, there's another idea I hadn't thought of, please, that Google Sheet is still available that Leslie brought to our attention, and you can add to that as we go. So we'll transition. Leslie will talk a little bit about mask and see if there's any other suggestions that you might have on this situation.
Thank you. I just want to get some clarity from those of you who are working with this in an in-depth manner every single day. So we have a document, OSD COVID-19 information with staff, that is really a one-stop shopping with excellent updated information. When our K-2 students started coming in person, we're of course following public health and CDC related to mask requirements. It's just that in addition to what was on their website, public health also said that sometimes a one-ply, depending on the manufacturer, sometimes a one-ply is actually thicker than a two-ply. And so it's really what's most important about a mask is that it's comfortable, it fits you snugly, and you will wear it. So we didn't require two-ply when we started, and we haven't up until we just started talking about that as something we're doing moving forward because of that advice, and because how are you going to check how many plies it has? We don't really want our kids fingering their mask to see if it's one or two ply. And we're certainly not going to do a ply check at the door. But so that was it, do we require two ply or more, which we've decided, yes, we will, because that is really the best information we can find out there. And that's why I would defer to anything that you guys wanted to tell us. We all know face shields are not a substitute for face coverings unless it's the Badger face shield. And we do have some teachers in the special education department who use that. And then we also know that bandanas and fleece are not acceptable. And we have some really good information on, why we wear a mask. And you can see that the graphic next to us. There's really not an argument at all from staff regarding whether or not to wear a mask. That's not the issue. I think their concern is, do we have the most updated, latest and greatest information on what is the most effective mask to wear during the school day for our students and for our staff. And so I know one of the people who couldn't be here tonight mentioned, do we do we purchase medical grade masks for our students and our staff? And I know that isn't the recommendation of public health. What we have been wearing, according to public health, is adequate. But I'm wondering what opinions all of you might have. And this is a important issue as we're transitioning more students and older students into in-person. We just want to make sure we have the best possible requirements out there. So I will stop sharing that. And then I'm open to anything that anybody has to share.
I can kind of speak from the hospital standpoint. Recently, I'd say within the last month, any cloth masks, regardless of layers, are being changed out to just a single ply for patients. So we are no longer allowing cloth masks in the hospital setting. So that, I don't know if that has anything to do with anything, but that's just kind of what we're doing for reason unbeknownst to me, but cloth masks are no longer accepted at any of the hospitals. So there must be some reason behind it.
Becky, is it because are they using the disposable ones, the blue disposables now?
Yep. For patients, staff has obviously higher
Right.
rate.
They have the N95s, right?
Yeah, we have both. So we don't use N95s for everything, but yep. So patients are just getting the little blue ones, the disposable ones.
So are those the surgical, like fluid resistant masks you're giving to patients? Okay.
Yep.
I'm not a medical professional, mental health professional, but if I come at many things from a very practical level. And I've always worn the medical mask because there's standards that apply to all of those that come out. And so they're all the same, right? Or they're meeting minimum standards, and you can actually form them to your face. They actually work quite well. Coming from a parental perspective, my kids also wear the medical mask, but now we've gone out to buy cloth masks because they're afraid that they're going to get picked on at school because they have the medical grade masks. So my again, personal preference, just based off of practical ideas, is medical is the way to go.
So I'm going to guess that the shift from in the hospital perspective is about supply, right? So when things started off, for a lot of conversations about concern about running out of masks, period. So that supply chain question is something that will probably move back and forth as the pandemic ebbs and flows. I think any mask that you wear is the best mask, right? Versus one that you're not going to wear. So I think that's probably the place where we need to start. I think we have articles on Hanes t-shirt masks that are good, and fine. So I think, I think what you need in a hospital setting is one thing, and what you need in a school setting is people, thinking back to that Swiss cheese model, right? All of these different engineering controls are important. Is a cloth Hanes t-shirt face covering ideal for healthcare? Absolutely not, right? But is it going to be what kids can wear, and will kids wear those masks? Then let's get those masks on them. Let's do the distancing. Let's clean. Let's do all of those different things. But I think we have to make sure it's what people can use and have access to. And I don't really want us to make one more thing that people need to buy, or I think we need to sort that out carefully.
Okay. Any other responses, thoughts to Leslie on masks as they formalize that?
This is Joanna Bisgrove. I'm so sorry I wasn't on before. It's my husband's birthday tonight, so we just finished up his birthday dinner. Just to pitch in with the masks, wasn't sure if this was just an idea, that's something that came up in our clinic, but if the school, I know the school has some plans to have some masks on hand, an idea that might be a fun one to consider Costco, apparently, this is where I heard about it at least. Costco and some other places, they have surgical masks that are bright colors. And so then there's an opportunity if people don't have a mask.
We lost you for a second, Joanna.
Okay, sorry. Can you hear me now?
We can.
Okay, I think where the patient's work got it was Costco, but I'm guessing other places. But the idea is that there are surgical masks out there now that are bright colors. The one the patient was wearing was pink, but just like, and rather than your typical mask, that's just your hospital mask, but ones that are colorful. And they sound like they're being sold in bulk. Just something if the school is going to be purchasing masks, something that's fun, something that will help the kids get engaged. I mean, so much of this, for a large part, I think from the experience I'm seeing when I'm talking to parents, the kids are doing a fairly good job. But for a large part, everything has been such a chore. I keep trying to think as a parent, as a pediatrician, a family physician pediatrician, is like, how do we make this fun? I mean, the couple of ideas I threw in there in engaging the community, I mean, thinking along the lines of the wellness committee for the community is how do we engage businesses? Is like, how do we try to, even though it's a pandemic, how do we keep this fun for kids? And that was something that popped up today. Was like, oh man, I have to get some of these pink ones for Maya. But at the same time, it's like kids like color. So they want to be creative with their own masks. With kids that can't, or if they forget a mask, they'll hang on, at least for the whole day. They'll hang on to one if they get to pick a color. It's like the kids who come into the office who have a broken bone, but they pick their color for a cast. So it was a thought. I mean, Costco is where this patient got it, but I'm sure there's other places. So that was my idea. Let's think of ways to make this fun, because that'll help keep the kids engaged.
Yep. Great. Thank you. Okay. Final calls on this, and then Leslie's going to wrap it up and talk about our focuses next meeting.
I guess the only other thing I would add is a lot of this is focused on our phased restart kids, and let's include our Oregon Online because they're a part of our community. And while they may not be coming into the buildings, they're certainly part of this effort.
Great. Thank you, Krista.
All right. First of all, I enjoyed the format of everybody together. It was nice to hear from so many people. All right. So our preparation for February 1st. We'll definitely give you an update as to where we are with our community efforts, the things that we've discussed tonight. We'll also give you an update and an opportunity for feedback on the grades 3 through 6 in-person phase-in. And we'll also seek your input on the phase-in processes for the next group to go in, high school, middle school, and then possible next steps beyond that. So we have lots of opportunity to update you and to get your input on the things as they are rapidly changing, because it's not just ready, set, we're now at the go. Tomorrow morning is the go. Our 3 through 6 are back for the very first time, and we're all pretty excited about it. It'll be so much fun to see them.
Mm-hmm. Great. All right. Thank you for that, Leslie. Yes, and thank you for your great suggestions. And you'll be getting a summary of all those ideas on how to engage the community. And Leslie will give us an update on some progress on that or plans being made for that as well. So that should bring it to a close. We're at 7:14. We meet in 2 weeks from now. Hope all goes well. And I hear there's a football game coming up or some sort. Yeah. So don't get together with anybody for that, please.
Please watch it alone in a room. Okay.
Family only. Yeah. Right. So.
All right.
See you in 2 weeks. Okay.